Sorry. So apparently I was talking to myself a little bit here. Quick revision. The first thing here, I want to remind everybody on how to use the GoToWebinar platform. So on the right-hand side of the screen, you see the panel where you can chat with us or ask questions. Not all questions will be answered during the session. Some I will be able to answer, just because it's very, very difficult to get aware of all the questions online. So that's the reason, not because not good enough questions or not good enough answers, just because I cannot see all of them. And if for some reason your answer is not answered, your question is not answered during the session or immediately after the session, then you can email it to us over the survey or directly to us, and we'll do our best to answer. So this is about the technology. Second thing is I've made some changes, and instead of giving the entire presentation at once about the two technologies that we're covering today, I will start with the Morpheus 8, move on to the hands-on part, and then come back to Fractura. They're quite similar on the terms that they're both fractional technologies, RF fractional technologies. So I'm thinking giving a good coverage of the Morpheus 8 will enable us to kind of fly through the Fractura later on. So yeah, we'll try and we'll see which method works for us best, like last week with the Lumeka and Thiolase Excel, or what we're going to try today. Excuse me just one second. Okay, so can you hear me now? I think now you can hear me, right? Just a second. Yeah, okay, good. So let's start with the Morpheus 8, as we call it, the subdermal adipose tissue remodeling applicator. So just a little bit before we're digging into the technology, the Morpheus 8 technology, I kind of wanted to give a short brief on what is the fractional technology. And for some reason, during the preparation for today, I didn't save these slides on my presentation. So the idea is to enable, of fractional technology, is to enable, instead of full resurfacing of the epidermis and dermis, is to enable healthy tissue to remain in between the controlled damage. And we will talk about it in more details later on. But the idea is that we are enabling faster healing, better healing to the tissue using the fractional technology. Hoping for next webinar in 2 weeks' time, these slides will be incorporated and we'll be able to discuss it in more details. Another thing to kind of cover briefly before we're digging into the technology is what is RF, and we will probably talk about that again when we're discussing Forma Plus and body effects and mini effects next week. But RF, as we all know, is part of the electromagnetic spectrum, and the frequency that we're using is dependent on the industry. So each industry worldwide has an allocation of bands that is allowed to use. So ships and submarines, radio waves and television, cellular phones and stuff like that, each have their own allocation of bands that they're allowed to use. In medicine, it's between 100 kilohertz and 6 megahertz, okay? And this is what we're allowed to use in medical devices with regards to RF. More specifically, in InMode, what we're using is 1 megahertz, and the reason we're using 1 megahertz is because at lower frequencies, what we see and get is nerve stimulation, which we're not interested in, and at higher frequencies than 1 megahertz, what we see and get is, or we don't see that as much as we see the nerve stimulation, but what we get is less localized RF and more radiation, which naturally we're not interested in. So all of our RF applicators based applicators are 1 megahertz, okay? And this is true for the Morpheus 8, the Fractora, Forma, and Plus, Body Effects, and Mini Effects, and the minimally invasives that are covered during the weeks by our great doctors all over the world with their webinars. So back to RF energy. So basically, we're talking about electrical current, okay? Electrical current can be divided into subtypes. In this case, we're talking about conductive RF, meaning it depends on contact. And I kind of like to take a minute and say that again, depending on contact, because contact with regards to all of our RF-based applicators is a key word, and I'm talking about all of our applicators, okay? So Morpheus 8, Fractora, Forma Plus, Body Effects. Later on comes the Evolve and Evoke that we will talk about again, and the minimally invasive, all depending on contact. So this is super crucial and super important to get good results and safe treatment. Further on, we can divide the types of radio frequency into generally 2 types, so bipolar RF and monopolar RF. Bipolar RF, the idea is that we have both of the poles, both of the electrodes, the emitting electrode and the receiving electrodes on the applicator itself. Okay, so very similar to what we know from our Forma and Plus applicators. So you see an emitting electrode in the middle, and then on the 2 sides you get the recipient electrodes, which kind of allows the electrical current to flow from one pole to the end, because this is what an electrical current knows how to do. Okay, RF, monopolar RF, the idea is that the applicator only contains 1 pole, so the emitting electrode, while the patient has to touch in some way the grounding electrode or the receiving electrode. Okay, so normally with monopolar RF, we're talking about patients sitting on the electrode, or holding the electrode, or laying on the electrode, and the current just flows from the applicator wherever we're applying it on the body towards the receiving electrodes. And some say monopolar companies that are using monopolar technology are saying our technology penetrates deeper. Well, in a way, it is true, but it penetrates deeper to areas that we don't know where. So electrical current, what it knows how to do is to flow from one point to the next, and it would always look for the easiest way to do so. So it would always look for the lowest resistance to flow through and the shortest distance. So we don't really control on where all the RF is concentrated in the body, as opposed to our bipolar RF applicators. We're in full control on where the RF is concentrated in the body, and we're making sure to concentrate it in the area that we want to work at. So if we want to apply this RF energy onto the epidermis and dermis, that's what we're focusing. Yeah. How does it work? Just very general on and kind of quickly through it. Electrical current conducted by the tissue increases the ion collision. So ion moves in the tissue and kind of touch each other. This touching, this kinetic energy is then transformed into heat, into thermal energy. So energy preservation law. And this heat then causes this controlled damage to the skin. So the controlled damage in the skin kind of triggers the body's immune mechanism, body's natural mechanism of healing. And this is what we're doing. We're just making the body work for us, okay? So if the body normally kind of lazy, doesn't want to work, if we're talking about more advanced age, okay, so not the 20s but 40s, 50s, body kind of laid back and doesn't want to work for us so much as it did in the previously. Now we're kind of making it work for us, and this is super important. And what we get eventually is the renewal of the tissue through the regeneration of collagen fibers, elastin fibers, and hyaluronic acid. More specifically, in Morpheus and Fractora, which are fractional technologies, this controlled damage to the tissue is delivered in a fractional way. So we're not damaging the entire layer. We're doing it in a very, very sorry, having a blank moment here. We're doing it in a very controlled way, so to say, just in some areas. Okay, so fractional technologies. Contraindications for all RF applicators, and these are just the more general contraindications that I would mention. And as I said previously, and I will say it again today, I'm expecting all of you to read through the contraindications in the operating manual. It is super important that you know. It is super important that your doctors know. It is super important that your patients are aware of the contraindication for this treatment, and that they're signing an informed consent form, so that you don't accidentally treat a patient who's contraindicated, and then you get side effects that you don't want to get. So any general medical contraindication for skin treatment, including pregnancy and nursing, a pacemaker or any defibrillator, synthetic implants and fillers, and I'm sure this question will rise later on, so I promise to answer that, and other implants in the treatment area. Morpheus 8 actually goes on all of the RF supporting platforms that InMode has, which means it can actually work with all of our platforms, except for the very, very old body type, the analog body type, but I'm thinking that should probably not be an issue today. Okay, so here's the formal indication for use from the FDA, and you should know this is the deepest FDA-approved fractional technology. And the official indication is intended for use in dermatological and general surgical procedures for electrocoagulation and hemostasis. Just a second, let's see, there's a question here, something that we want to, okay. Okay, so that's actually a good question. I kind of skipped that part because normally I do discuss it. I was asked what do I think about quadrupolar, tripolar, multipolar. You can call it any way you want. They're all bipolar RF. But instead of having just one electrode in the middle and one electrode emitting the RF, and then a second electrode that receives the RF, you have, normally they design it in a very, I don't know, kind of fashionable way or something like that, but they just have receiving electrodes on the applicator itself, and it's basically just bipolar. Calling it tripolar, quadrupolar, multipolar, they're all the same. Okay, they're all bipolar RF. It's just marketing strategy. So it's very, very similar. I cannot say that it's as good as ours because I don't know the technology, and we have a lot of other mechanisms that make and secrets that makes our technologies kind of superior to many others on the market, because RF is very, very common, but not all RF devices on the market knows how to do what we are doing. So just with regards to what is the technology, quadrupy, tripolar, multipolar are all bipolar RF. Okay. More specifically about the indications for use of the Morpheus. So Morpheus 8 is intended for use for the treatment of fine lines and wrinkles, scars, and skin irregularities. Now, when talking about scars, I want to talk more specifically about hypotrophic scars, not hypertrophic scars, okay? So elevated scars are not targeted with the Morpheus 8, and the reason is, if I take you back few slides is that we are actually promoting new collagen formation. Elevated scars are already showing more collagen formation in the scarred area, and we want to avoid that completely. Therefore, only hypertrophic scars. Improvement of skin tones, and what's very, very important and significant is that we can treat the entire body, okay? Face, neck, all body areas, everything that you can think of is possible. A little bit about the aging process, and very, very shortly, generally speaking, until the age of about 30, we kind of have a build-up of collagen and elastin. This is the prime line, yeah. So this is the youthful years, and everything's is just in place. Between 30 to 35, we're kind of reaching a plateau. There's no build-up, but there's no breaking down. And from 35 on, we're downhill. So breakdown rate is faster than the build-up rate, and this is where we come into action. Okay. So let's discuss about what the fractional technology of the Morpheus can actually do within the tissue. So it does triple action. It does fat coagulation, connective tissue contraction, and subnecrotic bulk heating of the skin. How does it do that? It does that by allowing the RF to work within the tissue. First of all, in different layers, which we will discuss how and what layers we can actually target. But for each pulse, we can actually see three distinct thermal zones. Okay, so the most the zone immediately surrounding the non-coated area of the pin causes ablation, where we have the highest temperatures. Immediately after that, we see coagulation, which that's basically the effect that causes the connective tissue contraction, and the non-specific heating. And as you know, this non-specific heating is also very, very important and very, very effective when it comes to skin tightening and younger look. Okay. So the fractional RF takes advantage of the healing power. We kind of discussed that already. We're making the body work for us. We're inducing that thermal injury in order to make the body create new collagen fibers, new elastin fibers. We have histologies showing this, and you will see it later on. And eventually, we're improving the laxity of the skin and reducing the appearance of wrinkles and general photo aging. This is how the multi-layer technology actually works. So we didn't really discuss yet about the specifications of the handpiece, but most of you already know, and those of you who aren't aware of this will get aware of this later on today. But Morpheus, one of the great advantages of the Morpheus is that you can control the depth of penetration into the skin, into the tissue. So up until now, we talked about 4 millimeter deepest penetration. So 4 millimeter, 3 millimeter, 2 millimeter, and 1 millimeter. So by controlling that, we can apply that fractional technologies into the different layers of the skin, working more efficiently all through the depth of the skin, and provide very, very good ablation and coagulation all through the skin. Okay, and this actually shows, and it's another presentation that kind of combines the two that we've seen already. Okay, so you see the three different thermal zones: the ablation, coagulation, and unspecific heat creation. And this is immediately during or after a treatment. And 6 weeks later, what you see on areas that were penetrated by the needles is you see that contraction, the formation, and this is an illustration of new collagen fibers formation. And you'll see it in the actual real life histologies. You'll see nuclei and collagen fiber formation. I'll walk you through it. Okay, again, this is more well, we kind of talked about it here, okay? So if we're talking about the three different thermal zones, these are the numbers. And sometimes I wasn't sure, because normally I kind of read my audience when presenting the numbers, because if I see that the audience is not receptive to hear about 100 Celsius degrees, then I'm not saying it out loud, because not everybody are okay with that. But what's important is that you know is that this 100 degrees Celsius is very, very localized. We're only talking about this high temperatures at the immediate proximity of the exposed needle, okay? So this is a very, very small area compared to the entire tissue, okay? And this is the area we are actually creating this controlled damage that we talked about earlier, that would make the body work for us, the immune system work for us. At around 40 to 50 degrees, we have subnecrotic heating. Coagulation normally occurs between 50 to 80 Celsius degrees with the addition of collagen contraction that also contributes to the tighter looking skin. And tissue denaturation, collagen and tissue denaturation at temperatures that are higher than 80 Celsius degrees, and we see that as well. And again, overall, what we get is initiation of the wound healing response of the body, very natural, very very physiological effect. So we're not talking, and this is also crucial, because actually what we're creating is a younger looking skin, but natural. So we're not going to have patients walking out of our clinic looking like monsters, and this is super important. Okay, a little bit about the coagulation zone calculation. So if we're taking into consideration the RF distribution around the needle, coagulation zone was calculated based on the volume. So yeah, at the end of each RF pulse. These are the specifications of the needles, okay? So the needle diameter is 250 microns. The uncoated tip length is only 0.5 millimeters. And having these numbers, we kind of get, we see, and this is a computerized model of the coagulation zone around the end bit of the needle. Of course, it is energy dependent. At an energy levels of 5, which are rarely used, the area coverage is less than 5% for coagulation. But the higher the energy levels that we're using, we get better area coverage and higher, larger coagulative zone. And if I take you back a slide, then or two, the coagulative zone is the zone that actually makes the body work for us. So ablative zone and coagulative zone are the effective zones that making the body draw the immune mechanism to start the work. Okay, now we've talked about the histologies, and here is a demonstration of the histology. So immediately after, what you see is the ablative crater, okay? So ablation only caused at the very immediate proximity of the exposed needle. And you see the large coagulative zone. You see that darker pink color of the fibers. This is an indication of coagulated tissue here. And then 2 weeks later, what we see here, and I don't know how well you see it on your screens, but you'll be able to use the PDF file that I've uploaded here and enlarge the picture if you wish. And you see a lot of small purplish dots, and these are nuclei that actually represent, each of them, a new collagen fiber. So this is really cool, because it's actually in the shape of the needle, and you can see the response that takes place 2 weeks after the treatment in the body, in the tissue. So let's talk about more specifically about the handpiece itself. Now I will present to you today some tips that were not presented or are not on the market yet. We're hoping to bring it to you as soon as possible. We have the Morpheus 8, the Prime, for smaller treatment areas. It will all get very clear in few minutes, and the body tips. Well, actually 24 is not true. So 24 polymer coated needles is true for the Morpheus 8. The prime contains only 12 sharp needles, and the body contains 40. You'll have a very nice table showing and summarizing the differences later on. What's important here is a return electrode. Okay, so if you look at that picture here, you see the return electrode grid, return electrode that symmetrically surrounds the entire surface area, and additionally you see the grid that surrounds each needle separately. And this is super cool because it actually enables you to work in a very uniform and safe manner on your patient. Another thing that Morpheus 8 features is the automatic synchronization between the penetration of the needle and the RF energy delivery. What does it mean? It means that until the needles have actually penetrated into the tissue, I will not get an RF application. Okay, so first needle penetrates the tissue. After penetration, we have a feedback mechanism. After the penetration, RF will be applied. If penetration did not take place, RF would not be applied, and that's another thing that helps you spare the epidermis. Okay, save it. We talked about different depths of penetration, so we have 1, 2, 3, and 4 millimeter for most tips. We'll get into more details later on. And another tip that was not part of these three is the resurfacing tip, which have fixed pins length. It is fixed at 0.5 millimeter length. It is not coated, and the idea is that enables you to actually perform resurfacing treatment. Okay, so to ablate the skin surface, to ablate the epidermis. Repetition. I normally do that when I do the hands-on part because it's more. It is clear that way. I would try to. I think I'll keep it that way. Okay, so we do have a hands-on part, and I'll keep it on the hands-on part because just talking about it doesn't make it very clear. Again, these things I kind of like showing during the hands-on part, and I think we will keep it that way with your permission. With regards to the skin, to the screen, sorry, with regards to the screen here, so the first thing you have to do for now is to choose the correct tip, because there is no tip recognition software. Okay, so this is super important that you're choosing the right tip, because the energy distribution changes if we're talking about 12 pins, 24 pins, or 40 pins. Okay, so think about that. Additionally, if we're comparing the 24 pin standard tip to the resurfacing tip, we're talking about depth of penetration. With resurfacing, we have fixed length of needles. Okay, so 0.5 millimeters, which will be disabled if the depth field will be disabled when choosing the resurfacing tip. So if we have the standard tip that can penetrate into 1, 2, or 3, and 4 millimeter depth, and the resurfacing is shown, then I'm not going to have the option to choose the depth of penetration. Other than that, we'll cover during the hands-on part. Okay, and I promise it'll be clearer, and here it is. Okay, so from the larger tip to the smaller ones, what you already know, most of you, is the standard Morpheus 8 tip with 24 coated needles that can penetrate up to a depth of 4 millimeter, okay, with energy levels of 5 to 60. This is what you already know. Some of you have already met the resurfacing tip, which, as I said, has 24 needles uncoated and are fixed at 0.5 millimeter with limited area, because working on the epidermal surface actually is more risky than working in the depth of the tissue. Okay, because this is the area we can actually might cause damage to if working in an unsafe manner. So these are the two that you might have met or heard about. What is new and not on the market yet, and will be soon enough, is Morpheus 8 body, which has 40 pins, and you can see there on the right, it's slightly larger than the standard pin. And in the future, not now, we'll have a penetration depth of up to 7 millimeter, and the idea is to enable you to work at deeper levels. Okay, so mainly cellulites and these kind of areas. Okay, so definitely body, not facial, not neck, nor anything like that. Okay, the deeper we go, the easiest it is for us to apply higher energies, because there's a less risk of damaging the epidermis. Okay, then Morpheus Prime is a smaller pin, as you can see here on the right, and it has 12 pins, and the idea is to enable you to work in very small areas like the periorbital area, the perioral area, the nose, any area that you may think of that require higher accuracy when compared to the standard 24 pin. That one actually enables you very accurate work on smaller areas, because we talked about, if you remember one of the first slides of the presentation, we talked about the importance of contact. This helps us maintain that super important contact while working on very small areas. So we kind of have it all now. And I just want to repeat, this is in the future. 5, 6, 7 in the future is not out yet, not possible yet. Okay. Additionally, what we see is we talked about penetration of up to 4 millimeter. In any case, we're talking about a thermal effect of 1 additional millimeter. Okay, so if we're talking about a penetration of 2 millimeter, the thermal effect would be up to 3 millimeter. Okay, and so forth. Uniform effect, we talked about. No damage to skin, to epidermis, is achieved with the help of the coated needles, the synchronization, the grid of the return electrode. So so these are all achieved with all these safety features. Okay, we're actually normally presenting this technology. I present it after presenting the Fractura, because Fractura is actually the base. Okay, Fractura is very well known technology for in-mode, very useful, very lovable technology, gave wonderful results, but we had some feedbacks from the field, and we took those feedbacks over the years and improved it to the point where we actually give you the Morpheus. So these are all lessons learned from the Fractura. And resurfacing with tip we talked about already, so let's move on. Yeah. Okay, let's talk about the treatment procedure a little bit. Okay, so proper patient selection, and this is actually true for everybody, not everybody, but for all technologies. Proper patient selection is crucial. If we will discuss a patient who's 70 years old, never underwent a beauty treatment in her life, and says, well, I just woke up this morning feeling old and I want to look 40 years old again, and this is not something that we can deliver. But applying the correct treatment and establish the correct expectations from your patient will enable you to create a good and happy patient. Any contraindicated medication should be stopped prior to treatment. Let's say, for example, what I can think of the top of my head would be blood thinners, for example. Okay, so aspirin, because we're talking about fractional technology where actually we may cause some bleedings, and if a patient is on blood thinners, then an excessive bleeding may occur, and that just puts them at higher risk. So if allowed by the physician who prescribed these medications, should be stopped. If not, then consider not taking that patient at all. So we always ask the patient to arrive with no skin, with a clean skin, but it's up to us to make sure that the skin is actually clean properly. Yeah, and what's important, and we'll discuss that in more details, is anesthetic protocol, because we did kind of lower the pain level as much as possible, but in order to do that best, we have to we have to apply some anesthetic means. Okay. This I would do during the hands-on part. Antiviral prophylaxis, just for patients suffering from herpes simplex virus infection. Prophylactically prescribe them with I don't know, acyclovir and stuff like that. Okay, prior to treatment, during, and a week after, to prevent any outbreak. Okay. What is important is before all treatments, we recommend a test spot. And I kind of discussed with you already about the importance of test spots when talking about the Lumecca and Dialyze XL, if you remember. Test spots are super crucial and are even more important when talking about the darker skins, okay? So 10-15 minutes for lighter skins and longer time, even 2 days time between the test and the actual treatment for the darker skin types. And the idea is to see the reaction, because what we give you is a set of recommendations, so a set of general numbers that would apply for most patients, but you're going to have to test this specific patient and your specific patient and make sure what is the correct settings for that patient. Okay, otherwise you might be not working energetically enough. You might be working at too high energies and create some damage that you can easily avoid with a test spot. Because if you perform the test spot and at the recommended energies and seeing that this patient reacts significantly more severe when compared to all other patients, then you'd know to work slightly more careful. Okay, all tips are arriving gamma sterilized from our premises, and it looks like this. Okay, so it arrives gamma sterilized. If you can show me the screen, that would be good. Okay, so tips are arriving gamma sterilized like this. All of them, all 4 types. Okay, so the resurfacing, the 24 coated, the 12 and the 40 will come separately packed. It is the first thing you do is you check the integrity of the package. Okay, and this is super crucial. If it's punctured, if it's open or anything like that, you put that package aside and you take a new one. Okay, because if it's open in one way or another, it means that it's not sterilized on our side. Okay. After opening the package, the sterilized package, I want to make sure that I'm not touching the end that would actually the area that would actually touch the patient's skin. Yeah, it's not very visible, but I'll show it later. That's the second thing I do. Afterwards, I do some more things which I will demonstrate on the hands-on part. Okay, and super important here is that we're talking about single-used tips. Okay, so for all we care, a tip is used once for each patient, and you get rid of it, and that's it. Yeah. So just a quick question, and then we're back. What kind of reaction we're looking for? Yeah. Okay, so it actually comes up later, but the reaction we're looking for is immediate. The immediate reaction of the skin that we're looking for is erythema, a little bit of edema, and normally that would be about it. We may see a little bit of bleeding during the treatment, which is fine. There's in wound healing, there is a statement that bleeding is good. Okay, so actually the blood is where all the immune components reside. So if we're actually causing bleeding, we're causing immune system to kick in. So erythema, edema, a little bit of bleeding, these are good responses. Depending on the depth of the work and the area that we're treating. Okay, so normally, well, you will. I'll present you with the recommendations for work on different areas of the body. But for face, for example, we're recommending a work not deeper than 3 millimeters. Okay, so when working at these depth, it's impossible to target fat layers in the fat, and we've never ever received a problem with that. So we did not melt down fat in facial areas. we do aim to work on fat, on subdermal fat layers with the body tip. Okay, so that's why we're adding the deeper planes, so 5, 6, and 7 millimeter depth.
Last question, does the percentage of area covered represent the amount of area covered for each stem?
Does the percentage of area covered represent the amount of
area covered for each stem?
Well, I'm guessing it, and that's if I'm understanding the question correctly. I will repeat the question. So does the percent of area covered represents the amount of area covered for each stem? And I will try to answer that to the best of my ability. And you're actually taking us back to that computerized pattern of area coverage percentage. Since we're talking about percentage, and so yeah, it does represent an overall coverage for each stem. And what I wanted to convey in this slide is the fact that even at very high energies, what you get is an area coverage, a restricted area coverage. So if you think about it, inside the tissue, an area coverage of about 16.4, if I'm not mistaken, 17%, would be like two electrons in an atom, okay, with regards to how close it is to one another within the tissue. So you're creating that control damage, you're making the body immune system to work, but you do it distant enough for the body to heal faster. So this is what I wanted to convey. Since we're talking about percentage, then yeah, percentage is relatively per area. So in a way, you can say that. Okay, moving on. Contraindication, please read them. I'm not going to go through them. I do want to, I promised I will talk about it. So let's talk about what happens to with patients that have Botox, fillers, and stuff like that. Botox, not a problem after the toxin binds to the receptors. So normally we're talking about 2 days, but to be on the 100% safe side, I say wait 2 weeks after Botox injections and then you can work, not a problem. Not the same for hyaluronic acids, fillers and stuff like that, fat injection, collagen. These are all possibly vulnerable by our technology. Okay, so we did not, the bottom line is that we did not test it. We don't have a study shows this is safe. I do have doctors saying, and I did receive these feedbacks. Okay, I did have doctors saying I work on patients with fillers, not a problem, but I'm not taking that responsibility. We did not perform any studies proving that it's safe. For all I care, we're working at high enough temperatures to possibly create damage to that filler, to melt it down, and then it would reset in the body in a way that we don't want it to set. And therefore, I say if you want to combine, perform the Morpheus treatment or Fractora treatment, then inject your patient same day, a week later. Okay, that would be the right way to combine the two. So cover that. Please read through all the rest of the contraindication. Yes, methods of anesthesia. So most commonly used is topical anesthesia, and if you ask me, it is more than enough. If you're using the topical anesthesia, by the way that the instructions that are applied in the package, you normally are good to go. So topical anesthetic mostly applied for 30, 45, 60 minutes, depending on the production, and then you might be slightly limited with energies to those tolerable by the patient, okay? Depending on your patient, depending on the percentage of the numbing cream. So, for example, what I have today here is this one, because there is a shortage of EMLA cream now in Israel. Yeah, so that one is lidocaine and prilocaine, over 5%, and gives really good anesthetic, topical anesthetic effect. Okay, that's all I use personally. I don't like the higher percentage. I don't like the all the kind of side dish preparation. I like the ones that I can buy at the chemist, at every chemist. Okay, those that are safely prepared and have all the approvals. Okay. Other than that, you can use nerve blocks or local anesthesia if you're a doctor or if you have a doctor in your clinic, or tumescent or IV sedation. Normally, these two are only when combined with body tight, base tight, acutite, and so forth, okay? The method of anesthesia also kind of affects the levels of your treatment, and we'll discuss it in a minute, okay? So different areas are targeted with different tips, and we kind of discussed that already. So with the 12 pin, with the prime tip, you can target very small and difficult area like the upper lid, the upper lip. With the standard Morpheus 8 tip, 24 pin, which is this one, you can target soft and bony facial areas, neck, and stuff like that. With resurfacing tip, you can target all body areas and just provide resurfacing. Thank you. And 40 pin tips, normally the idea is to work on larger treatment areas like abdomen, thighs, buttocks, and all. And in the future, as I said, and we'll say again, we will have deeper depth of penetration. And here are the set of recommendations. So because it's very, very specific with depth and all, it kind of separated on two different tables, okay? So I'm not expecting, I will not read you through this table, and you don't need to remember that because you always get that table in the QRG, okay? So for now, the QRG is updated to the tips that are already on the market, which are the standard 24 and the resurfacing, but does not contain the 12, the prime tip, and the 40. Once it's out, you will have that one on the QRG as well, okay? So no worries, you don't have to remember that, but you just, it kind of gives you the guidelines, okay? It also includes the number of recommended sessions, the week in between session, the expected downtime, and the more superficial we work, the longer the downtime that we'll see, and the longer the gaps in between the session, okay? Now, yeah. Another thing to look at is the deeper into the tissue we work, the higher the energies that we can actually use, okay? So more superficial tips and depth of penetration, I recommend using lower parameters. Deeper penetration, we can work safely at higher energies. So this is what I want you to take from it. I'm not about to read each and every line of that table. Okay. These are also stuff that I normally cover during my hands-on part, but since it's all kind of entangled together today, then as I said, deeper the treatment, higher RF energy. Treatment may be applied to all skin types. Just be careful with the darker skin types, with the skins that tend to behave with hyperpigmentation effect, okay? So these you would want to reduce the parameters to begin with. A further reduction of 20% of the energy when working on thin skin like the neck, or on bony areas like the forehead, and further 20% reduction if you're working on thin skin over bone, okay, like the décolleté or something like that. This is it. Can we show the parameters again? Yeah, guys, I can show parameters again. You also have it on the handouts, okay? If you see on the right-hand side, you have handouts. I gave you the QRGs for both Morpheus and Proctora and the presentation that I'm working on at the moment, okay? So you all have it. So you can open it is on PDF format, but you have it, okay? I kind of want to move on because we only have 1 more hour and 2 hands-on part and Proctora to cover, okay? So let's do that. Selecting treatment parameters. Okay, we've done that. So what I do want to say here is types of lesions. Okay, higher energy should be used for deeper lesions like acne scars and deeper wrinkles. This is very, very important. The more difficult the indication, the higher energies that we would want to use. Okay, so based on that, we kind of adjust our parameters. So we take into consider the skin tone, the skin type of our patient, and the type of lesion, and we kind of integrate it into a final decision of what parameters we choose. Of course, after performing a test spot, okay? And what is important, because normally we're not talking about a single treatment, but we're talking about a series of about 3 sessions. It is also possible to start at the relatively lower ends of the recommendations, and as we see the patient's reaction to our treatment, we can increase it. And this is a very, very good method, especially when talking about the darker skins. Really?
How many times we can cover the area in one treatment?
Okay, so this is a really, really good question. How many times we can cover an area, or in other words, how many passes we can deliver during a treatment, depending on the treatment area, depending on the patient, depending on the indication. Okay, so the more difficult the indication, the more passes I would want to provide. What I normally do is based on my patient ability to withstand the treatment. So I would start at the deeper plane, and if I see the reaction on the first round, the more advanced the pass is, the more painful it would be perceived by the patient. So first pass is the least painful because A, I'm working deeper in the tissue, and B, skin is not irritated yet. So if I see patient is already struggling on my first pass, then I would plan my treatment accordingly. So I would do just another pass at one more depth. But if I see my patient is receptive, I can plan ahead and do 2 more passes at different depth, or even 3. Okay, so generally the more the merrier. I would want to work at more than one level of penetration. I would want to apply more than one pulse into the tissue, and I will, once we're discussing the hands-on part, which will be in a few minutes, I will demonstrate that, because we also have some tricks on how to stack pulses into the tissue. Okay, and this is very, very important. Next question.
Would it be that eat from acne scars and skin type 5?
Post-inflammatory I'm guessing you meant post-inflammatory hyperpigmentation. If not, please write, because I'm missing the term here. PIE, post-inflammatory erythema. Yes, so post-inflammatory erythema after acne, I would combine this treatment. If a patient suffering from post-inflammatory erythema, I would combine Morpheus treatment with Lumecca, because Lumecca can treat very well the erythematous part, okay, and Morpheus would treat very well the scarring tissue. You'll see really, really good results with just the Morpheus. So yeah, I'll show some pictures in a minute. Okay, so good coupling importance, and I kind of I'm sorry, but I want to rush things, so we'll have time for everything. So we're sometimes losing contact when we're working on a very soft tissue, if we're not applying firm enough pressure with the handpiece on bony areas, and that's when we get the bad coupling message. Okay, so actually it tells us no RF was delivered. How to overcome these issues? So first would be to apply the handpiece perpendicular to the treatment area, and this is super, super crucial, okay, because we talked about the importance of contact. So applying it perpendicular to the treatment area kind of make sure that we have good enough contact. Additionally, applying firm enough pressure. Now, depending on the area, depending on the problem, we can either stretch the skin or pinch the skin in order to be able to work in a safer manner, okay? Another thing is to ensure that the patient is not moving around, okay? So I kind of hold my patient so they don't run away from my needles, because they tend to do that. So just hold them and make sure that they're not running away, because it actually is safer for them if they're not running away from your applicator. I see there are more questions in just a few seconds. Okay. Yeah. Okay. The different differences between surgical conditions and clinic conditions, generally speaking, and I will do it in very general notion. Okay. Under surgical conditions, when patients are, when we're using tumescent anesthesia, and tumescent also contain adrenaline and very efficient lidocaine infiltration, skin turgor increases, and therefore the receptivity is higher. Okay, so under and this is I'm gonna do it fast because we're mainly gonna talk about clinic condition today. Under surgical condition, skin is more receptive and enable you to work at higher energies when compared to clinic conditions. Since we're talking about clinic conditions, let's keep safe. Okay, I'm quite sure this is it. We'll cover that during the hands-on part. Okay, so how to use it, overlapping 50%, stacking, we will cover that. Endpoints we've mentioned already, so substantial erythema, edema, and pinpoint bleeding are good. Very important during the treatment, before and after. Cooling the skin is very effective with regards to patient sensation. Also enables you to work at higher settings and deliver a more effective treatment while keeping it safe and less painful for the patient. Okay, best if you have a possibility to use an air cooling system like simmer, highly recommended. If not, then you can use ice packs, whatever. Just make sure to dry out the skin if you're using ice packs before applying the applicator, if you're doing it during the treatment. Post-treatment. So post-treatment, any soothing ointments will be fine. You may consider applying antibiotic cream if necessary. That's up to your, definitely with acne patients, I would want to use, active acne patients, I would want to use antibiotic. If not active acne patients, that's your discretion to make, okay? So that's your decision. And moisturizer, sunscreen, and makeup should be applied when holes are closing, so not before 48 hours post-treatment. Sunscreen should be, this is something that is super important for all of the fractional technologies, okay? And all of the skin irritating technologies. Patients should avoid sun as much as possible. So I always instruct, and I tell my patients what are the risks, okay? I explain them. If you're not listening to me, to my instructions with regards to sun protection, your risks are hyperpigmentation, okay? To avoid that, it is very easy. Apply sunscreen, avoid sun, wear hats, stay inside for the duration of the treatment. Do not irritate the skin any further. Yeah, let's do the question.
Okay, if we do three passes of each 3 minutes, 2 minutes, and 1 minute, is it too aggressive for darker skin type?
Yeah, so for darker skin types, let's say 5 and 6, I would be a lot more careful. I would not apply 3 passes immediately with all different depth. Okay, I would start with the deeper levels, and I would for darker skin types, I would try to avoid working more superficially, because the risks, as we said, is hyperpigmentation, and we want to avoid that. So I would work deeper into the tissue, and I would always start with lower parameters, and I would increase them gradually during the treatment. So I would, on the scale of efficiency and safety, I always need to be safe first, and then I can provide an effective treatment. So it's no useful for me if I solve the acne scars problem, but then they have hyperpigmentation, right? So I rather do it, I rather tell them, look, because of your skin type, I would want to meet you 6 times instead of 3, and increase the energy levels gradually. Okay, so this is it, and definitely not work too aggressively. But once I know my this specific patient, I'll be able to adjust the parameters in accordance to their skin reaction. And this is super, super crucial for darker skin types. Yeah.
How do we clean the tip during the treatment?
So during the treatment, if you need to clean the tip, I recommend having like a little brush, disposable one, something cheap. Doesn't have to be to remove any cellular debris and stuff like that. If needed, if you have a lot of cellular debris, you can also soak it in peroxide, hydrogen peroxide, and alcohol for like further disinfection, especially important with acne with active acne patients. Okay, so this is something that is it is important. Okay, next, can sunscreen be applied on same day? Well, generally speaking, yes, sunscreen should be applied immediately after treatment. It might burn a little bit, so I kind of avoid that. But yeah, you can apply and should apply sunscreen. I think that's it, right? Okay. I have Fractora and I'm extremely happy with it. I was looking. Just a second. Wait.
How many passes with Fractora on face? Second pass be at higher or lower level? Just looking behind and around what I can hear. Also, we use purely low pulse.
Wait, I will try to read it here because I have Fractora and I'm extremely happy with it. Of course, you're extremely happy with it. Was looking to ask how many passes with Fractora on face. So how many passes? My answer is very, very similar to Morpheus. Morpheus is slightly safer than Fractora. Then I can apply as many as tolerable by my patient. With Fractora, I would go for 2 passes for best coverage. Okay. Should second pass be at higher or lower level? Depending on your patient. If patient is now more relaxed and say, okay, I can withstand this kind of treatment, you can increase the energies, by all means do that. If patients say, well, I'm done, no more, then maybe suggest another pass with lower energies. Okay, so you have to be very, very in tune with your patients. Okay, it's very difficult to say to give a general recommendation that would suit all of the patients, but it has to be after communicating with your patients, especially with these more painful procedures. Just look. Okay. So let's move on to the hands-on part for the Morpheus. Just briefing you on the benefits: safe and deep fractional treatment, uniform effect, almost no damage to the epidermis, which means, and this is super significant, short to no downtime after treatment. So some patients, especially with face that heals faster than compared to body, if not a very super aggressive treatment, we're talking about an erythema that lasts 2-3 hours post-treatment, and that would be it. There might be slightly edematous and all, but the erythema subsides few hours, couple of hours after the treatment, and patients are almost back to normal. The effect, normally I do get this question asked during the lecture part, but effects, maximum effects of the treatment are normally shown within 3 weeks to 4 weeks post-treatment. Okay, due to physiology. Okay, so we need to give the body time to work for us. Here you can see the effect on the nasolabial folds. Again, a little bit of filling effects, the neck area 10 days post. So just imagine what would be a month after the treatment. Upper lip, very nice effect. Again, different body areas, abdomen here with energies as well. So you can see we can get really, really good results. Very, very efficient treatment for relatively low efforts on your side and the patient's side. We will skip that. You can see, by the way, I will say you can on the InMode Resource Center, you have a lot of webinars and videos, clinical videos. before and afters, clinical materials, marketing materials, okay, for Morpheus as well, for all of our technologies. So log in, subscribe to the to that InMode Resource Center. You would gain a lot out of it, okay? So I would now switch cameras and cross.
We had a question from Richard in Australia. It's already midnight, and he wants to know if he's going to sleep.
What's the rush? Don't go to sleep. Spend another hour with us. Listen about the Fractora. It's not like tomorrow. It's like we're all staying at homes anyway.
When can we have our time that they will optimal results?
Okay, so I would say normally I would wait not before 1 month post treatment and maximal results 3 months after treatment. Okay.
Another question about surgical scars on the face. When treating surgical scars, what depth would you recommend?
So scarring tissue, scar tissue is always slightly more complex indication to treat. If it's hypertrophic, because a lot of scar tissues are post-surgical tissues, scarring is hypertrophic. Avoid touching it. We do not want to stimulate any more collagen formation. If it's hypotrophic scars, you can treat it. The deeper the scar, the more energies it would require. Okay, the higher energies it would require. Quick question: how many insertions can be done with the tip? It's unlimited. Tip is unlimited. You can work. I don't know. I have made more than 1,000 insertions in a single treatment, and it's still sharp and working perfectly well. Okay, we've tested it.
They want to see the first photo again, but I don't know if we have time.
First photo, this one. The photos you have. Okay, so let's move on to the you have the photos, you have this presentation. Okay, so just look at it. Okay, so I am going to switch to my other webcam so you can all see Lisa. She's waiting here very, very patiently for her Morpheus treatment. So let's just make sure that we see her. Yeah, here we go. Okay. So we are starting with the Morpheus 8 applicator now. I will just touch it. I need you to let me know how we are with times, okay? Because I want to, at 30 past, I want to start with Fractora, so we have enough time for Fractora. Okay, so we have 15 minutes for this hands-on part. I know it's rushed a little bit, but I understand, as we said, we have guests, we have people with us from Australia that are desperately wanting to go to bed. So so we're kind of trying to do our best in the settings. Okay, so let's talk about Morpheus. This is the connector. It is slightly different than what we know from the Fractora. Both of the fractional technologies can be connected at the same time. And if you see on the screen, I don't know if you can see it very well, but on the screen, what you choose is fractional rather than not very well shown. Okay, but you play with your system at home and you'll see it. You don't choose Morpheus or Fractora, but you choose fractional. When both are connected, it would automatically work with Morpheus. So if you wish to work with Fractora, make sure to disconnect the Morpheus, and then you'll be able to work with the Fractora. Working with the fractional, okay, it enters automatically the Morpheus 8 tip. Now, before entering the operating screen, it is super important that we're actually working with the tip, because what I didn't show here.
One second, we need to switch to the webcam because they don't see.
Okay.
Switch to this camera.
Yeah.
Okay. Okay.
You don't. Okay, so we're having some technical difficulties. Just a second. No?
We got a message from Sandra that she still see the presentation window. And,
Okay, so that's okay. I see. How about now? Better? I think it's better now. Right? Now you can see the video. Okay, so before entering the operating screen, what we want to do is connect the tip to the handpiece, and I will try to demonstrate it to the best of my ability. I kind of hold it like this, okay, and I'm applying it and pushing on the top bit, okay, and it should click. Now it's on. Now when I enter the fractional screen, you would see a self-test. You would see that the system performs self-test, and you'll see the needle goes out and in, and this is important. Okay, did you see that? Let's show it again. It is very, very slight movement. You kind of see it on the screen, but yeah, that's what I can show under these circumstances. Okay, I will try and advance the system a little bit so you can see the screen, the operating screen. We discussed, no. So sorry, but we have our limitations. We're gonna have to adjust the camera. Yeah. Okay. So as you see, it doesn't recognize the tip. It automatically goes on the resurfacing. With the resurfacing, there is no depth control. So since I'm working with the standard 24, I need to change it to 24. Then I can work a different depth of penetration, okay? So 1, 2, 3, and 4. Energy levels are set based on the recommendation that we discussed earlier. Now, what I want to discuss now on the hands-on part, because the treatment for Lisa is important, but she's gorgeous as it is, and I want you to understand the system very, very well. So we have mode of operation and repetition, which we have not discussed during the lecture part. Mode of operation can be set on cycle or fixed. On cycle, we have a single pulse, so needles goes out of the handpiece, give one pulse and come back. How fast they do it depends on the repetition rate. So cycle mode with single, each press on the foot switch would give me one ejection of the needles and one pulse. Okay, so let's see that. And I would work on 1 millimeter because I want you to see that without disturbance of the bad coupling sound. Okay, so cycle, single. Yeah. If I want to apply another pulse, I'm going to have to lift my foot off the foot switch and apply and press it again, okay? So this is cycle and single modes. If I would work on cycle mode, but faster repetition rate, okay? If I would work cycle and 0.5, for example, then every 2 seconds, I would have needles coming out, giving RF, and going back in. And then I can move on the treatment area faster. Okay, so let's see that. It looks like this. Don't know if you can see any needles coming out, but okay, you can hear it. And same goes for 1 pulse per second. I recommend when using cycle mode, not using faster than 0.5. In my opinion, even for the more experienced user, 1 pulse per second is too fast for you to move from one place to the next, establishing good contact with the skin applying firm enough pressure, and also please, 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 if you ask me, for safe work, don't work faster than 0.5 pulses per second on cycle mode. But cycle mode is nice, but what is super, super cool is the fixed mode, okay? And I'll tell you what is cool about fixed. The fixed mode enables you to work with the needles outside. So I only have to penetrate the skin once. Needles are already in the tissue, and I can apply as many pulses as my patient can tolerate, okay? And I will just, we will have a bad sound, but I want you to see how it looks like. So I'm going to use 4 millimeter, and yeah, so a repetition, the repetition rate here can be 0.5 for so 1 pulse per 2 seconds, one pulse per second, or 1.5 pulses per second, which I think is too fast. This is my preferable settings, okay? Fixed 1 pulse per second, very, very good for all in-depth work. For more superficial work, I normally choose different settings, but we'll discuss it in a second. Okay, so this is how it looks like. You see the needles are, oh, here we see them. Needles are still outside, and as long as my needles are still so camera is out of focusing, and it's making it difficult for us to see, but I urge you to play with your system and explore it without having a patient on your bed, okay? So sacrifice one tip, and then you'll be able to learn these exact things that we're talking about, okay? So this is what I do for in-depth work. Another thing I want to discuss on the screen is the pulse counter, okay? So I like actually taking notes of how many pulses I've applied in each depth and each area, okay? So I can work, and then I apply these pulses, and it gives me an idea of approximately how many pulses I want to invest in each side and area. And it also gives me an idea for the next treatment, whether I want to work more intensely or more easy. Okay, so let's pretend we're giving Lisa a treatment, okay? So before treatment, yeah, I think we're done with the screen. So before the treatment, what we didn't do here, because as we said previously, Lisa is very forgiving. What we did not apply anesthetic cream 45 minutes before that. Normally we apply anesthetic cream. We apply the anesthetic cream. We cover it with the plastic wrap. Okay. Now what we want to do is remove the anesthetic cream, and we want to clean up the face with alcohol. Okay. So a little bit of medical grade alcohol and a gauze, and I'm just going to clean up the face. And we also have a doctor who's cleaning, Dr. Hellman from New York, who's very, very experienced and had very, very impressive results, who says that she's cleaning the face with peroxide. So, of course, very, very lightly and gently. Okay, so I'm cleaning the face with alcohol. I make sure that the entire area of the treatment is cleaned properly, and now I can move on to the treatment. Okay, so as I said before, I start from the deeper plane and go superficially. So on the face, I don't work more than 3 millimeters, so I would adjust it to 3 millimeter. Standard energies treatments, let's say 30. Yeah, and one fixed and 1 pulses per second. So normally when we've talked about it earlier, what I do is I hold my patients. Okay, I hold my patients, And I let them know how it feels, okay? I want them to understand very, before I start the full treatment, I give one pulse, I make sure that I'm perpendicular to skin, and I'm applying a little bit of pressure. You see, I'm maintaining very, very good contact. And that's when I give the first pulse, and I let them know I'm going to give the first pulse. And as you can see, I'm supporting her head so she does not run away from me. And I give the pulse. Okay? Now that my patient says, oh, so it's not too bad, I can start my treatment. And during my treatment, I want to make sure that I overlap about 50%, okay? Because we discussed it, the distance in between the needles, the area coverage is almost like comparing electrons in an atom. So I apply 2, 3 stacks in the tissue, 1, 2, 3, and move on. 1, 2, 3, and move on. 1, 2, 3, and move on. This area that I'm targeting now, just below the zygomatic arch and the zygomatic arch, are normally areas that are more difficult to target, and you have to make sure that you're pressing firm enough on your patient's skin, okay? Otherwise, you would lose contact, and if you lose contact, you have adverse events. So these curved areas, these bony areas, should be targeted in a very, very cautious way. Another thing to say about this area, especially when I'm working on the under eye area, what I do, and I'm hoping you'll be able to see, I apply my handpiece and pull it down like this, okay? So again, I apply my handpiece and pull the skin down. You see what I do? I'm still perpendicular. I'm still pressing firm into the tissue, but I'm pulling the skin down. Maybe I can show it on. Huh? Okay, and this is how it looks like. You've asked how many passes and how many pulses. So the idea is that immediately after treatment, I would see the erythema, I would see the edema. I can already apply another pulse if I see that I missed an area. So if this area does not have an erythema, I would give here another pulse, okay? Second pass, as I said, normally sometimes more painful because skin is irritated. So I would want to adjust accordingly. And that's why, and also I work more superficially, and the pain receptors are more superficially located in the skin. So altogether, it is slightly more painful. And in addition, I'm working closer to the epidermis, so it's slightly riskier with respect to adverse events. So I want to lower the energies on the second, more superficial pass. After done with this standard tip, I can, let's say I performed treatment on 3 millimeters and 2 millimeters, I would remove the tip. And to remove the tip safely, what I want to do is I want to hold the handpiece and I hold the tip as well, okay? Because I don't want, if I don't hold the tip, when removing the tip, what happens is that it just flies away, okay? So I'm going to demonstrate the correct way first and then the wrong way. So the correct way is to hold the handpiece and the tip, and I remove it safely, okay? I don't want to fly it in the room. It's not, doesn't give your patient a nice reassuring feeling. I'm not holding in this, what happens, okay? And you want to avoid that, okay? So this is that. After done with this, I would apply the resurfacing tip for working on the epidermal level. I would want to provide the resurfacing, and with the resurfacing, the number of passes is depending first on my skin type. The darker the skin types, I would be more careful. I would even consider not using the resurfacing tip at all. For lighter skin types, I can work more aggressively. But you remember, we're working fractional technology, so my aim is not to peel off the epidermal level completely, rather the opposite. I want to trigger it to heal faster, okay? And these are my aims. When working with the superficial tip, another thing to remember is that you have a longer downtime, okay? So you're actually creating scabs. You're creating wounds on the epidermal level, which will take time to heal. So a day or 2 days post-treatment, these entering points of the needles would would appear as crusts and scabs, and patients should be prepared for this and know that it's not a problem covering them with makeup. So I think with regards to morphs, the one thing I didn't mention is the lead bar on the top. Jenny, if you can just hand me the tip over there. Thank you. And this is a nice indication to have. This lead bar actually indicates you have the number of lights showing the depth of penetration. So when I'm working at 1 millimeter, you see just that light. On 2 millimeter, you have 2 lights. Let's see that again. On 3 millimeter, 3. And on 4 millimeter, now you'll see it on the other side, it'll be very apparent. You have 4, okay? So this is a nice indication. So for you as an operator, you don't have to go back to the screen and look what the settings are if you're not sure. You just look at the lead bar, and it indicates the depth of penetration. It's super cool. Okay, so I know, and I'm sure you have some questions, but we will move on to the Fractora, and because we only have 30 more minutes, and I want to be able to cover Fractora for those of you who are not working with the Morpheus. So if you have more questions about the Morpheus, just ask me, and we'll come back to you, okay? But not now, not at this specific moment. Okay. Yeah, let's switch the cameras. This whole webinar concept is really taking us to the extreme with our technical abilities. Oh yeah, let's switch cameras, moving back to integrated camera. Let's rock. Here we are, and share screen again. Do you see my screen? Good. Oh, just a second. We'll get there. We'll get there. Here we are. Okay. Okay, so Fractora is basically the older generation with very similar indication, textural changes, fine lines and pores, wrinkles, depressed scarring. Okay, only depressed, hypotrophic, because we're working on the same mechanism of action. So we're actually promoting collagen formation. A little bit of targeting epidermal melanin pigmentation with the help of the superficial tip. But with regards to melanin pigmentation and vascular lesions, we have the Lumecca. So if you have both of them, that would be a better choice. A quick video that demonstrates how the Fractora works. Okay, so here how it actually looks like. Okay, so we're talking of, and this is very similar. I will speak slightly faster now because these are familiar technologies and very similar to Morpheus, but let's say downgraded a little bit. Okay, so we have the needles and we have the RF coming out of the needles towards the side electrodes. Okay, so the positive RF electrodes are the pins and the negative are the side electrodes on let's see them. Maybe I'll show it. So look at not at the presentation, but on the camera for a second. Okay, so you see the side electrodes. These are the positive ones. So the energy flows from positive to negative. As we talked about electrical current, that's what it knows how to do. And this is how it looks like. So we have the ablative zone, the coagulative zone, and the heating zone. Okay, reepithelialization and phagocytosis of the debris, and the final effect is the remodeling of the tissue, a more organized dermis with more collagen fibers and more fibroblasts. So what are the specifications? So for Fructora, we have 3 different tips that we're talking about. We have the standard 24 pin coated one. Sorry, this is the coated one on the right side, coated, where the RF is only being delivered from the very end bit of the pins. Okay, here it is fixed depth of penetration. It's not like the Morpheus. This is one of the main differences. Okay, so the side electrode as the positive electrodes, as opposed to the grid that we had with the Morpheus, and here the fact that we're fixed depth of penetration of 2,500 microns actually, so it's 2.5 millimeter depth of penetration. And second tip would be a non-coated tip of the Fructora, where you have the RF delivery from all through the length of the needle. Okay, so it doesn't spare the epidermis at all. This one spares the epidermis, only applies RF deeper into the tissue. Here the RF is being emitted from the entire length of the needle, and the 60 pin tip allows for penetration of only 600 microns, so 0.6 millimeter depth. Deeper, sorry, not deeper, but more shorter distance in between the tips, in between the pins, and this is aimed for more superficial dermis effect and epidermal ablation. Okay, and here it is again. So you see the different looks. It's very easy to differentiate the 60 pin tip from the 24. Slightly more difficult to differentiate between the uncoated and the coated. A good tip on differentiation would be to look for the silver dot, and I will show it to you right now. So if you look at the silver dot, it means that this is the coated pin, okay, and you're working with that one, with these ones. Okay, the non-coated one doesn't have that silver dot, and this is an easy and good way to differentiate between. Yeah. So this is well, this is actually showing it again. So the 60 pin tip, penetration of 600 microns, 0.6 millimeter depth, providing epidermal ablation and superficial dermis ablation and tightening. And this is how it looks like, the 60 pin tip. Okay, so immediately after, or 5 minutes after, you can see and smell the ablative craters. Okay, 24 hours you see the inflammatory reaction of the skin. So you see the erythema, you see slight edema. 48 hours you see the scabs. This is very typical, nice reaction of the 60 pin tip. Similarly, we see with the resurfacing tip of the Morpheus. Okay, 24 pin. This would be the non-coated, because you see that the RF is being emitted all the way through the needle. Transdermal ablation, so targeting the entire length of the tissue, entire depth of the tissue. And the 24 coated one for subdermal effect, using a polymer coated pin. Okay, so we're targeting deeper structures in the tissue. It is used mainly, the idea is that it's safer for the epidermis, okay, when compared to the non-coated pins, because we're not delivering any RF on the epidermal surface, and therefore slight lower risks of hyperpigmentation post-treatment. And this is how it looks like, the non-coated versus the coated. So on the left-hand side, you see the coated, much less effect on the epidermal surface, and the non-coated one, you see more significant inflammatory response on the surface of the skin. And this is the histology is done with the actually, yeah, okay, with the Fructora. Okay, so you see coagulative zone, surrounding the ablative crater. Okay, so this would be the darker purplish colors. 1 week later, you see a lot of nuclei, which are the fibroblasts, new fibroblast formation, and new epithelialization and phagocytosis. Okay, and 2 weeks later, what you see is the new. We talked about a more organized dermis layer, and this is exactly what we see here. The darker colored collagen fibers are more organized and newer fibers. Okay, and this is an effect that we see with the coated pin. So you see there's much less significant damage to the epidermis, and most of the damage is concentrated within the tissue. And again, coated versus non-coated histological aspects. So when do we choose which one? Ablative 60-pin tip is used for normally together with the coated 24-pin for full face ablation, and maybe used for other body areas as well. Okay, the coated and uncoated 24 pins are used for deeper wrinkles and acne scars, coated for darker skins and for deeper tightening, and the non-coated can be used especially if you want to spare the use of another tip. Okay, if you don't want to use the 60-pin tip, you can use the non-coated one for lighter skins, and that kind of saves you the use of another of a second tip. Okay, here too we have to make sure that we have that we're using the right tip. Okay, there is no tip recognition software, so so please make sure that you're working on the correct tip, because as we said, the energy distribution changes. If I say I'm working with a 60 pin and I actually have the 24 pins connected, then I have double the amount of energy that I think I have, and that might be risky. Okay, and we don't want to put our patient in that kind of risk. So always double check your tip that is on the screen and the tip that is connected to your handpiece. Okay, energy and pulse mode, it's very straightforward. The energy levels and the pulse mode, the speed by which you work. Less complicated. Again, not going to read through it because you have it, and it is not something to remember, but it is something to follow the recommendations. Okay, so the treatment protocol is very similar. Topical anesthesia, all anesthetic aspects are similar or exactly the same as with the Morpheus. The one thing that is slightly different and is important when talking about the Fractora after the Morpheus is pressing the tip into the skin simultaneously while pressing the pedal. And the reason is, and I will talk about it again on the short hands-on part that we have. The reason is that we want to, in this case, we don't have the synchronization of the RF, but as soon as I'm pressing the pedal, I have RF, and the RF kind of facilitates the entry of the needles into the screen and helps with pain relief. Okay, so the RF kind of melts its way, melts the needle way into the tissue, and it perceives as less painful for the patient. An overlap of this to avoid overlap of the side electrodes, we recommend an overlap of approximately 30 to 50%, and I will demonstrate that the direction by which we move on the hands-on part. And here too, second or third passes may be applied depending on the indication and the patient's ability to withstand. Endpoints are more visible in this case and may last longer. So more substantial erythema and edema, very visible ablative crater, and the smell of a burn tissue is very prominent in the case of the Fractora, especially when compared to Morpheus, because there is always some RF applied to the epidermis, even with the coated one, because again, there is no synchronization. Okay, so only when using the 24 coated pin, and this is very important, because with the Morpheus we talked about stacking pulses into the tissue with all different depth, with all different tissues. with all different tips, sorry. But with the Fractora, I recommend stacking tissues only when using the 24 coated pins, okay? And this is important. When stacking pulses with the non-coated, you may harm the epidermis, you may have adverse events. So please avoid that. Not more than 2 to 4 consecutive pulses, again, in order to protect your patient's skin. And this is also done only on soft tissues, okay? So don't stack pulses on bony areas like forehead and décolleté and stuff like that. When working with 2 tips, and this is very similar to Morpheus, start with the deeper one and then move on to the more superficial, to the 60 pin. Higher parameters used on face, and this is generally speaking with everything, okay? Because face ability to heal and adjust is much better than the rest of the body. So higher parameters for face, reduce a little bit for the neck, and further reduction for different body areas. Darker skins, again, lower parameters and gradual increase during as we go along during the sessions. And I will take a little bit more than 2 hours with your permission, because I don't want to rush through, and I think we don't have any other webinar planned for immediately after our session, right?
Right.
Okay. Just a second. Okay, so yeah, and of course, according to patient tolerance. So about pain management, it is exactly the same, okay? So anesthetic wise, you can do topical anesthesia, local anesthesia, nerve blocks, and all work with tumescence after body tight, face tight, acute tight. Air cooling is the best type of cooling before, during, and after treatment, if you have it. If not, then any other cooling means is acceptable. Just make sure to dry up the skin before, if you're using wet cooling means like ice packs and all, okay? We've talked about that. Full contact. Now, I do want to take a minute and talk about full contact with regards to the Fractora, because in the Morpheus, we've implemented a lot of safety features that we, as I said earlier, we kind of learned our lessons with the Fractora, and we've implemented all improvements into the creation of the Morpheus 8. So full contact with the Fractora is super crucial, because the RF does not have, we don't have that synchronization that protects the epidermis. That's the first thing. So you may be able to apply RF even when just working very, very on the very surface of the area, okay? So we really want to avoid that. So full contact. Another thing is that if you look at the shape of the tip, we don't have the grid surrounding each needle. It means that all energy flows to the side electrodes. If accidentally I have bad contact, let's say I'm contacting just one electrode, then all energy would concentrate on a single electrode instead on 2. So that would be double the amount of energy concentrated on one side of the handpiece, and the chances for damaging the skin are much, much, much higher. So everything we talked about with the Morpheus 8, with regards to importance of good contact and good penetration, is even more important to make sure that is happening now during the treatment, because the chances for side effects is slightly higher here. So another thing that we do to make sure that we avoid that is applying pressure. For darker skin types, you may combine bleaching treatments after. Normally recommended if hyperpigmentation is developed. We discussed on how to prevent the hyperpigmentation with the help of guiding your patient, okay? If you do perform bleaching, you have here an example of a treatment regimen. Okay, so this could be done in 3 to 6 weeks before the Fractora. You want to continue it for about 3 months after, depending on the needs, but always before the consecutive session, cease the treatment for 48 to 72 hours, okay, in order to avoid any possible damages. Always use milder parameters when working on darker skins. Protect from sun and increase gradually. And this is the most important tip that I have for you for Morpheus and Fractora when working on darker skin. Increase the parameters gradually. This is super, super important. Better be on the safe side and provide a slightly less effective treatment, but keep your patient happy. Make sure that they come back for the next one, because if you harm them on your first session, they will not be back and will not be happy with the results. So better be on the safe side. A little bit of, actually, it's not a little bit of before and afters. We have a lot because Morpheus is slightly newer than Fractora. Fractora has been on the market for years and years now. So that's what we've heard before. So somebody said, I have Fractora and I'm super happy with it. And I said, of course you are. Everybody's super happy with it. You see the before and afters are coming again and again and again. We have great results with a single treatment. So if you nowadays the energy levels are limited, so it's not possible to work with the 60 pin tip on 60 energy levels, but only up to 30 energy levels to keep you on the safe side. Okay, so it's very, very safe for somebody of this skin type, but darker skin types using 60 energy levels with 60 pin, that's disaster on its way. So we're helping you avoiding that. Okay, so you see the effect on even on the epidermal pigmentation, and definitely on fine lines. And this is like life-changing for that patient that's years taking off her face. Okay, again, only 2 sessions, relatively mild energies, and look at these amazing results. We see the significant improvement of fine lines and overall textural changes of the face. The crow's feet area, which is super difficult area to treat. Pores on darker skin types or skin type 6 work lower energies, 1 pass. So you see these are very, very mild energies used, but because we're using on skin type 6, we rather perform more sessions at lower energies and be safe. Okay, so that would help us create a happy patient. Neck, and this goes on and on and on and on. I want to move a little bit to acne scars, so you can see very good results after a single session. You already see a significant improvement. Okay, acne scarring. So we talked about earlier, we talked about post-inflammatory erythema. So here you see a very nice example of that. Same goes for Morpheus, naturally. Yeah, well, it speaks for itself. I don't feel the need to say anything. Same here. And it goes, yeah, it just continues. The results are countless, and we see them again and again and again. So let's see if we have any questions about Fractora.
We also have from hands-on from Javier that seems to need to cover patient eyes.
Oh, that's actually a good question. There is absolutely no need to. Javier was asking if we need to cover patient eyes. No need. When working with RF, there is no risk for eyes at all. If patient is feeling more comfortable with eyes covered, you may do that. Personally, I think most people like to be in semi-control of the situation, and covering the eyes kind of takes it away from them. So they're feeling more confident if if I'm not covering their eyes. If you feel like it's going to calm down your patient, you may do that. It is absolutely not required.
Richard.
Yay, Richard!
On loose skin, is it better to pull or filtered skin?
Again.
On loose skin.
On loose skin.
Is it better to pull the skin?
Oh, that's a brilliant question. Thank you, Richard. Yes, on a very loose skin, a lot of times what I do is I pull the skin, and I will show it on. I should have shown it on the hands-on part for Morpheus as well, because this is something that we do for both Morpheus and Fractora, and I will show it with the Fractora in a minute. Okay, how to stretch or pinch in order to adjust to the treatment area.
Okay, and we have a question regarding the Morpheus transform. What is the difference between cycle mode and...
Okay, so I will repeat the differences between cycle mode and fixed mode. On cycle mode, each press on the foot switch gives you the needles go out, give one pulse, and come back. Now, depending on the speed, on the repetition rate that I choose, it chooses how fast I do that. So cycle mode on single, I give one press on the pedal, one pulse only. To apply a second pulse, I would have to lift my foot off the foot switch and repress it again. I can also work at a speed of 0.5 pulses per second, or 1 pulses per second, or 1.5 pulses per second. And that means, again, I'm talking about Morpheus cycle mode. Cycle mode at 1 pulse per second. Every second, I would have the needles go out, giving a pulse, and retracting back. And as long as my foot is pressed on the pedal, I will have that going on and on and on. Okay, so needles go out, pulse, go in. Go out, pulse, go in. 1 pulses per second, 1.5 pulses per second, or 0.5 pulses per second. This mode I mainly use for bony areas like the forehead, décolleté area. Okay, for all the more for the softer tissues, I use the fixed mode. Why? Because the fixed mode, and the idea is that we call it fixed mode because the needles are fixed outside of the handpiece, okay, of the tip. The needles, I press the foot switch on fixed mode. Needles go outside and they stay fixed outside, okay. And as long as my foot is pressing on the pedal, I will have the needle outside, inside the tissue, giving pulses in the speed I choose. 0.5 pulses per second, 1 pulse per second, or 1.5 pulses per second, okay? My preferences for cycle mode would be 0.5 pulses per second, not working too fast, because I think working too fast on cycle mode will yield you adverse events of not having good enough contact. And for fixed mode, I think 1 pulse per second is the best for tissue response and for patient tolerance. Okay, because working faster is just too painful for your patient. The tissue is heating up too fast. Working too slow is just wasting your time, and you can work faster. Okay, hope that was clear.
And how close can you get to the eye? Can you go to the eye?
You can work. So again, I kind of demonstrated it with the Morpheus. Same goes with the Fractora. I can work on wherever. I would not work directly over the eyeball. Other than that, I can work everywhere. Okay, so I would make the necessary adjustment using the new prime tip, enabling me a work that is very, very close to the eye. Okay, because it's much smaller, enables me to work on the upper lid, on exactly in very close proximity to the eye, assuming that I have the tip. If I don't have the tip, so what I do is, and I showed it before, I kind of apply the tip And instead of applying the pulse here, which is on my eyeball, I kind of pull it downwards, and then I apply the cheek over the zygomatic bone. Okay, and that enables me to work on the skin without risking the eyeball. Okay, so let's move on to the hands-on part for the fractura.
1 second.
Yeah.
Which is the cycle mode or the fixed mode?
So, okay, so it's a good question. There's no one answer for which is safer, because I think it depends on where you're working. So for bony areas, it'll be we're only recommending working on cycle mode and no stacking. Okay, this is for bony areas like forehead, décolleté, head and dorsum, less fleshy areas, more delicate skin. Okay, this is our recommendation because we feel it's safer on cycle mode without stacking. Fixed mode, on the other hand, enables you less penetration to the tissue and working within the tissue. So it is safer for more flashy areas like the cheek, like the neck, abdomen, thighs, buttocks, and all. Okay, so depending on the area that you work with, it changes the safety profile of different modes. Yay, Richard. Guessing you're gonna have a late morning tomorrow. Camera. Yeah, switching cameras. Thank you, Judy. Okay, so can we combine fractura and Morpheus? Yes, you can combine it. I don't see a reason why you should, because well, up until recently, we didn't have a good enough answer with the Morpheus because we didn't have the resurfacing tip. Okay, we only had the 24 coated pin, and our users and patients still were left with no answer to the resurfacing epidermal resurfacing needs. But now that we have the resurfacing tip for Morpheus, I actually don't see the need to combine them. So unless you don't have the resurfacing tip yet and you do want to provide that epidermal resurfacing, in which case I do recommend combining them. If I have the choice, I will work with the Morpheus. Okay, so switching cameras. Okay, see how she's waiting patiently? Okay. So I want to take us back to the fractional technology on the system. So if I want to work with the fractura, and if you can see, I have both Morpheus. Okay, so we have both Morpheus and fractura connected. It's on the back side of the system, but you trust me by now that if I say that both of them are connected, if I choose fractional, it would automatically recognize Morpheus. So the first thing I do, if I want to work with a fractura, would be disconnecting the Morpheus. Okay? So I did that, and now when I enter fractional, I can work with my fractura. The left handpiece is not connected. Okay. Oh. Here we are. Let's try again. Seems to have some problems with the handpiece recognition. I will quickly check if I have another handpiece, okay, because maybe something's wrong with the connector here. I should have another one in the room, so few more seconds of your time and we'll solve that problem. Okay, back to business. So it was just an old connector, so we kind of have to play with it a little bit more because here I'm demonstrating connecting and disconnecting like a million times per day. So this is what happens. So Fractora is now connected, and here we are. Fractora is now connected, and as you can see, tip is not recognized. Okay, I see some that we have some delay video issues now. Okay, the way to connect the tip here, you see, I don't know if you see it. Oh, video is not best at the moment. You see the slots inside. Okay, it's horizontally located now. Match it with the shape of the pin of the tip. Okay, you don't have to turn, you don't have to do anything, you just kind of click it in, push it in. Okay, gently. Make sure not to be too aggressive with that, so not to destroy the tip. Okay, so that's the first thing. Second, you want to make sure that you're choosing the correct tip. Now I have the 24 coated pin connected. I see that it's 24 based on the shape of the side electrodes and the density of the needles. And I know it's coated because I have the silver dots here on the pin, on the tip. On the screen, it shows 24 pin. If it was on 60 pin and I have the 24, then it's dangerous, okay? Because I have double the amount of energies that I think I deliver. If it was the other way around, if I had 24 pin on the screen, but 60 pin tip connected, then it's the least, that way we have slightly less effective treatment, but it's not dangerous as much as it was on the other way around, okay? Because we have actually 2 times less the energy than we're thinking per pin, because this is an energy per pin. Okay, so energy levels again based on the recommendation on the QRG in our interaction with the patient. Pulse mode can be set to single, so every press on the pedal will give us 1 pulse. In this case, I remind you, we don't have synchronization between the penetration of the needles and the pins, so it looks slightly different. We can work at 0.5 pulses per second and at 1 pulse per second. And 1.5 pulses per second, I highly recommend it if you're a new user to the technology, you don't use 1.5 because I take you back to the first slide that we discussed today. Conductive RF, depending on contact. Contact is a key word for a safe treatment. Okay, so if you're an inexperienced user, use lower speeds. Okay, so I think 1 pulses per second enables me to work fast enough and to stack pulses in the tissue if that's what I choose to do. Again, here, as with the Morpheus, I have the pulse counter here, and here it's slightly less significant because I don't have the different depth. Okay, so I only want to make sure that I'm applying similar amount of pulses onto each side of the face if I'm working on the face or areas or different areas, because when working with the Morpheus, I would want to actually write the different depth and the number of pulses per area per depth. Okay, so this is a slight change. It's easier here because we don't have different depth. We're only working at 2.5 millimeter depth. Okay, so then I press standby and I can start the work. Now we talked about, again, let's talk about the fact that we did not apply anesthetic cream. We did not apply any topical anesthetic cream. But if we would have done it on a real live patient without corona in the world, so I would now clean the face. And I didn't say that with the Morpheus, but normally when working on the face, what I like to do is clean half the face and leave the second half of the face untouched, still with the anesthetic cream, so not to waste its activity. Okay, so I would only clean it when I'm done with my first side of the face. Okay, so it kind of preserves the anesthetic effect for longer time. And we talked about overlapping. So I use on each of the tips. It doesn't matter if it's the 24 pin tip, the coated, non-coated, or 60. On each of them, you have that screw on the pin, on the tip, and it would always be on the side of the electrode. So moving, this is just it's like a tip. It doesn't really matter. If you don't do that, that's okay, but it helps you if you're following these instructions. It helps you avoid side effects. Okay, so if I'm moving in the direction of the screw, then it helps me avoid overlapping of the side electrodes. And in this case, it's even more crucial because I remind you, we don't have the grid surrounding each separate pin, but we only have the side electrodes. So again, I disinfect with alcohol after removing the anesthetic cream, and I let my patient know how it feels. And again, it is super important. And this time it is important because, as we said before, we don't have the synchronization. So in order to avoid applying RF, theoretically I can apply an RF pulse when on the distance like this. Okay, so you see I have really bad contact now. I'm only touching with one electrode and some of the needles, and with the Fractora, it will be possible for me to deliver a pulse. So it is super crucial that you're working perpendicularly and pressing against your patient's skin, okay? And applying RF, okay? Now, in this case, I'm stacking pulses. And as you can see, I'm progressing in the direction, I'm overlapping 50% and progressing in the direction of the screw. And that helps me avoid overlapping of the side electrode. I have promised to show what I do on different areas on loose skin or different areas. So I have two options when talking about loose skin or areas that are more difficult to target. So one of the areas that normally we're struggling with is is the jawline, okay, because it is very bony and very, or sometimes it's very loose for older women actually, and curved. So in these areas, what I like to do is I like to do this. Okay, so I'm pinching the area, and it enables me to work on a more soft tissue kind of area. Okay, so I'm pinching it and applying the hand piece, and then applying the pulse, pressing the foot switch. Same thing goes for the neck. Okay, so my patient, sorry. So same thing goes for the neck. A lot of times on the neck we have a lot of loose skin, especially on the mid area. Okay, especially on the middle area. I would want to do that. Alternatively, I would wanna stretch the areas. Stretching normally, if you ask me, I'm using the stretching technique more on the abdominal part, especially for women after pregnancies, where they have a more significant amount of loose skins, or on the arms, for example, where loose skin is more prominent, and it's not just very slight wrinkly skin. That's where I like to stretch the skin. And in order to stretch the skin, let's say, let's maybe demonstrate it on the arm, okay? Okay, so this is an area that normally has a lot of loose skin, and we would want to work more accurately on the treatment area. So in this area, I would actually hold it and stretch the skin as was suggested earlier, and that way I can work. Okay, in similar technique, I would still overlap 30 to 50%. I would still stack pulses if needed. I would still progress in the direction of the screw. Okay, but in this area, in abdominal area where patient tends to have more loose skin, stretching the skin. So I'm holding my fingers, my fingers together, and then stretching them enables me better work, better contact, safer treatment. I think that was clear. Let's see if we have questions on Fractora. Thank you. Let's see if we have any questions here. No, yeah. Lo, clearly. Wait. Okay. Other tips? ولا احفظها. أنا مستكلت كيلو. I look at the still awake, and that was the last one before the hands-on part, right? Okay. Can we combine? And that we've answered that. And is it necessary? I kind of answered that one as well, right? So are the tips for the Fractora still not sterile, or have they changed? No, tips of the Fractora are still not sterile. Only part of the world where they come sterilized is Canada, based on Health Canada requirements. This has not changed. Okay, so Morpheus 8 tips come sterilized, and Fractora tips come as usual, not sterilized, but packed separately. Okay, and cleaned. Yeah. Next question here is it normal for the RF energy to hit the nerves and have electrical shock sensation during treatment? Okay, so this is a very nice question. What we say is not an electrical shock so much, but we may see some nerve stimulation. So we may sometimes see like a twitching, okay, of the face during the treatment. Normally it doesn't stay, and even if it does a little bit, then it subsides in no time. okay? And yes, it is normal. The electrical shock sensation normally is when we don't have good enough contact, okay? And this is something we should avoid. Next question. Is it on dinner time, not bedtime? Okay. Wait. Mine does the same sometimes. Ah, okay. So bleeding under the skin, I've experienced, especially with people who's not been honest with me. So when taking medical history, and I'm asking if there are any bleeding disorders or if they're on any blood thinners, and they say no. Normally, immediately after a few pulses, I already see that they lied, and then I ask again, and they go, "Oh yeah, I do take aspirin, but it's just one pill that kind of thing." As you say, older patients tend to have more sensitive skin and may have more superficial capillaries, and the whole vascular system is slightly more superficial and more fragile. So we might be seeing a little bit of more bleeding, nothing to be worried about. Okay.
How long does it take to face full face?
I think it's very personal, depending on your experience, depending on how aggressive the treatment that you deliver. If you stack pulses and deliver 2 or 3 passes for a patient, then it would be longer. Personally, I'm applying a relatively higher amount of pulses, okay? So it takes longer. If you're more on the safe side, so to say, then you might provide less pulses during a single treatment, and that would shorten your treatment time significantly. But I like to say that this treatment should not, from beginning of the actual treatment, from first pulse to last, should not take too long, 15-20 minutes tops.
Are you using the foot pedal to deliver the RF?
Yes, so both technologies, for both Morpheus and Fractora, I'm using the foot switch in the manner that I've described. Okay, so for Fractora, we only have to consider how fast we want to deliver the pulses, because there is no engine behind it. Okay, so it's just about how fast I deliver pulses, and if I want to stack pulses in the tissues or not. And I work with the foot pedal. So if I stack pulses, I press, and then the pulses would be delivered at the speed that I chose, okay, shown on the screen. Single, 1 pulse per second, or 0.5 pulses per second, 1 pulse per second, or 1.5 pulses per second. And as I said, only for more experienced. And with the Morpheus, we first choose cycle or fixed, and then choose the speed if we're working with the different modes of operation. Always using the foot switch. Yes, there's no finger switch to any of these technologies. Can you use, oh, great question. So can you use Morpheus and Fractora on skin with melasma? As we talked about last week, and as most of you probably know, melasma is super complex indication, super difficult indication to treat. It is complex because of the causative agents that are numerous, okay? So it's sun, it's genetics, it's hormonal, okay? With regards to the causative agents. It's complex because it resides in different layers of the skin, epidermal, dermal, and junctional. And it is difficult to treat because it behaves differently, and not in an expected way, not necessarily in a way that we can expect how it would react. And therefore, I would recommend, if you're treating a patient with melasma, do it carefully, because they have the tendency to hyperpigment, okay? So you want to reduce that risk, and you want to work at a relatively lower parameter. I would start very, very low and I would look for the reaction over in between the sessions. Okay, I would start very carefully because they can still gain a lot of skin tightening and all, but I want to be extra cautious because the tendency to hyperpigment.
Any chance of burn with the storm?
Yes, there are chances for superficial burns, mainly if you're not working correctly, okay? So if you're not maintaining good enough contact, if you're not applying firm enough pressure, if you did not work perpendicular to skin, if only one of the side electrodes of the fractura is touching the skin, the other one doesn't, and for some reason we have an energetical concentration on one side of the electrodes, of the return electrodes, and not the others, that's when we have a possibility for burning. If you're correct, if you're working based on the recommendations that we gave today, and as part of it, I recommend work slower and lower parameters if you're a beginner. If you're following these instructions, you're safe. Okay.
Oh, one. Okay. The next, what is your
Poikiloderma. Okay. So if the aim is to treat, like one of our customers said, the coagulation helped the redness.
But it was
That makes sense. Okay, so because we're talking about fractional technology, then we're not targeting the entire surface of the tear. So we're talking about, I'm sorry, I will take us one step back. So poikiloderma, okay, if you remember, it's the redness of the neck area. First of all, I recommend treating it with Lumecca. Okay, get very, very nice results on poikiloderma patients with Lumecca. You may combine it with Fractora or Morpheus, and yes, coagulation will coagulate blood vessels in the treatment area, but would not, that because we're talking fractional, will take longer time to achieve uniform effect with regards to coagulative effects of it.
What are the possible complications?
Infections, not sharp enough, and more. I actually don't want to think about it because they're single used and come sterilized from our offices. The other thing is that if you autoclave them, we can't assure that the mechanism, that the mechanical components will survive an autoclave, okay, because they're not supposed to. So
More packages,
with the Morpheus H, we recommend more packages. You mean more sessions per package as we're working? I think generally speaking, that would be a smart move. It is more business decision that I cannot actually advise on. But my clinical opinion is to work lower parameters, more sessions on Fitzpatrick's 5 and 6. So in a way, yes, but again, it is a business development decision to make, not so much clinical. So yeah. Okay, wow. So that was yeah, that was a nice session. Thank you all again for joining us and staying with us. I'm hoping I've answered most of the questions. If not, write them down to me. I'll answer them. It might take a while, but I will get there. And thank you. And we'll see you on Thursday if you want. And on Thursday, we will discuss Forma plus Body FX and Mini FX. And that would be on, I think, 10 a.m. Central European time. So we'll see you then.
Good night, everyone.
Good night, everybody. Bye-bye.